All right, so the next we will talk about is scholarship. Kind of a big word. I'm going to try to make it more manageable. Look at it, it is achievable, and then it doesn't have to be intimidating. So we'll define what it is, and it actually is a pretty big, broad definition. Why is it important? And how do you get started? So really the definition is pretty small. Serious formal study or research of a subject. So that's how Webster defines it. Scholarship is really a time to think outside the box, and especially when we look at medical education. Scholarship can be looking at developing an education curriculum project, presenting it, and that is a piece of scholarship. Scholarship can be doing a podcast, having it on YouTube, viewed by 1 million viewers, and that's a piece of scholarship. So you have something that you've developed, that you've presented, that you show that is being used by somebody else, either publication or looking at number of hits on the website. So scholarship is not just publishing in JAMA. I mean, I think when we look at scholarship, we're like, oh, I need to write papers, and that's what scholarship is. Early on, I was a third-year resident, and my partner in residency and I decided, oh, we're going to write an article and for American Family Physician. And at that point, there were no reference managers. I think we still typed it. You know, it was just, and it was so much work. And after that, I was done. I was like, I'm one and done with papers. But it's really, you know, since then, things have changed, and there's many more ways that you can publish, that you're not looking at a review article and pulling 200 copies of articles and trying to pull something together. So when we look at publications now, and I will go over a little more thoroughly what we call FPIN, which is Family Practice Inquiries Network, which is a wonderful place to get started in publications. And it's very accessible, but also, as I said, curriculum development. And looking at going at conferences like STFM, Medical Education Conference, the annual conferences are great ways to start to get your presentations on a regional or national stage. Doing book chapters, and we have a lot of resources within our department. Dave Rakel has a number of, a couple major books, and he will be looking for authors every few years with the different editions. Serena Schrager has worked on one with family medicine, has worked on women's health books, and also solicits authors. So there's opportunities within our department in terms of working on book chapters, just within our department. Podcasts, and I will look at our website and our YouTube channel, which started in 2007. And right now we have 3.5 million hits on our channel. We have the most hits of any academic department in the US, medical department. And this is including any of what's considered the top 10 medical schools in the country. So we have a very successful YouTube channel. You can get involved in it. We're always looking for people to do podcasts to keep things fresh and keep the YouTube channel going. So why do it? You know, we're here, we're in academics, we're all, physicians are curious, academic physicians have a passion around education. We want to spread what we're doing and also learn from others. Promote thought, debate, critical thinking. It helps make connections, especially when you go to conferences. And it really is energizing and stimulating. I think the reason I'm in academics, it is one of that constant stimulation I get from learners in terms of keeping me to be up on task, to be up on things, and to keep learning. And we know that learning doesn't stop when you get your residency graduation certificate. And I always tell people, I think the first year out was my steepest learning curve. I mean, it really, is that continuous learning, and to have people around you that are stimulating, you know, it's been a great ride. So again, what is it? So it's anything that can be presented or published. Peer review, and that's going to be more important when you look at promotion. You know, was it a peer reviewed? And when you look at that CV template, you do then differentiate peer reviewed from non-peer reviewed. But it's important to do the non-peer reviewed also. And others have recognized your work. So either when you look at, especially the journal articles, you can see how many people have cited your article. So that's considered a important factor. So other people are citing it in their articles. Is it one size does not fit all? There's a whole range of things you can do. So let's look at things that even in our department. So around curriculum. So we look at the ALSO program. That started in our department. So it was mainly Jim Damos, at Baraboo, John Beasley, who's here, and Jan Bird, who is retired in community practice. So they got together and said, we should have something like ACLS for obstetrics. And they brought it together and brought these scenarios together. And they developed ALSO. So they then pretty much gave it to AFP for $1. They sold it to AFP. And we know where that is now. It's throughout the world. And there are just countless people that have been trained that are using ALSO. So that is, kind of probably the exemplary example of what you can do in terms of looking at developing a curriculum and show that it's being used by others. As I mentioned in the previous talk around, digital. So digital curriculum can mean a lot of things, but looking at, our podcasts, and Kathleen Carr had developed the musculoskeletal curriculum with a working group. And when she went up for promotion, then showcased that as part of our promotion packet. And when you look at our videos with musculoskeletal, they're one of the most viewed, mainly because they're very practical, they're short, and very useful. Thinking about, I had this interesting case, wow. Thinking about writing that up. There, it's still journals, even Wisconsin Medical Journal, that will do case-based reports. And those are relatively, they're not as time-consuming as a review article, but those are ones that are like, oh, I should write about this. This was unusual, and other people can learn from this. Writing about curriculum design and implementation. So when you are doing a project, and look at Serena's talk in a few minutes, how to turn that into a publication. When you're thinking about something, always think about, well, what can I do with this? How can I spread the word, either at a conference or through a publication? Doing research, and our department, again, is rich with people doing amazing research and getting connected with people you have a similar interest in doing research. And definitely reviews. Where do we publish? Obviously journals and the family medicine journals. I mentioned already the books, and especially the chapter editors that we have in our department. And when you look at the the electronic publication, kind of the three main sources I'd like to have you know about today that are peer-reviewed. So if you get a publication that's considered peer-reviewed electronic publication. So first is FMDRL, Family Medicine Digital Resource Library. So that was started kind of as within STFM, and it is, you submit your publication there, it is peer-reviewed and then accepted. MedEd Portal is through the AAMC, American Association of Medical Colleges. A little bit more focused, that curriculum, on medical student education, but it still also has residency education in it. So another good place. These are also good sources when you're looking at developing a talk or developing a workshop, to go to these sites and see what other people have done. It can help guide your presentation. And the third is POGO, and that's the Portal of Online Geriatric Education. So it's more specific for geriatrics, but again, it's a peer-reviewed site that you can submit to. It said to get involved with the YouTube site, just contact me and I can get you started and how to develop. And Matt Fleming is our extraordinaire put together of everything for the videos. And contact me, I can help you get going. And how do you start with a podcast? How do you put it together? The STFM residency curriculum is another project I wanted to let you know about, because you guys have done already good work and you should get it published, and this is another place you can get it published. What the residency curriculum project is a group there. I'm one of the national editors. There's 7 of us, and we're looking to develop a curriculum. Right now we have about 350 topics that we'd like to eventually publish, and we're looking for authors to submit their curriculum, and they're basically going to be case-based presentations on a subject. If you go to the site for STFM, there is a call for the curriculum on the right-hand side, and there you can find the list of still available topics. And what we ask is that you have a facilitator's guide, a mini presentation, and then cases with a quiz, and that's considered the curriculum. So we'll have then, once we have enough topics that we'll release it, we're hoping to release in the next 6 months, residency programs can then access that curriculum. So it's been a fairly large project, but we're making headway, and we still are looking for authors. And again, this will be a way to get a digital publication. So I mentioned FPIN, Family Practice Inquiries Network. This was started about 10, 12 years ago, and UW is one of the founding members of FPIN. Currently, Dr. Lee Dressang is our liaison. So when FPIN started, this was really when evidence-based medicine was really starting off, and we're looking at, well, how do we evaluate the evidence? How do we get this information out? And so the emphasis was, how do I answer point-of-care questions as a primary care physician? And out of this, they've developed a number of publications. So the main ones that faculty have been involved with, and residents, have been what are called help desk answers. So these are small evidence-based reviews of a clinical question. The questions are available on the FPIN site in terms of working on a specific question, but you can also submit a question. So again, you've had somebody in clinic or had someone in the hospital. It's like, how do you treat that? Or what's the best management for this? You're already looking up the information. This is pulling it together in a 200 to 300 word document. Evidence-based practice then is the publication that it's published in. And then kind of a step above that are what are called the clinical inquiries. So it's a little more in-depth review of a clinical question. These are published in American Family Physician and Journal of Family Practice. And they're very easy to get involved in. Because we're one of the founding members, we also have library assistants. And Chris Hooper Lane, who will be speaking with us this afternoon, is one of the librarians here who is available to help with searches. So we have that assistance from the librarians, which is wonderful. So that, again, looking at where to publish. Now, where to present. And I think, getting started looking locally, regionally, Local presentations at hospitals, they're considered actually more of a regional. Some of them can be a regional presentation. When we look at regional here, the Family Medicine Midwest is a very good conference now in its third year, just finished in Minneapolis, but that's a great place to present. The UW in the spring, the School of Medicine and Public Health, has a medical education day where they call for posters. Wisconsin Academy of Family Practice is another place to submit for posters, presentations, locally, regionally. And then STFM has a number of conferences, so Conference on Practice Improvement, Medical Education, and then the annual conference. All places to present and a great place to network. So the take-home points really are, when you look at scholarship, it's not, don't be intimidated. It can take many forms, many shapes. It's very doable. Start small, and you can collaborate, use your mentor to help, look at, well, where should I attempt to publish this or ask other people? Think outside the box. Really, anything can be turned into scholarship. Be innovative. And there's opportunities out there within our department, so just ask and collaborate, and definitely it can be fun.